My name is Dr. Gomez. I'm a cardiologist who specialises in heart rhythm problems, and I'll be speaking about an electrophysiology study, which is an EPS, which is a procedure used by cardiologists to investigate patients with certain cardiac symptoms. The most common indication or reason to do an electrophysiology study would be because of dizzy turns or blackouts. So a loss of consciousness is a problem that can be related to the heart, particularly the heart's electrical system, where the heart is either too fast or too slow. And that situation can cause a decrease in blood supply to the brain. And if that occurs, a person can develop symptoms like lightheadedness, dizziness, or a blackout. Other reasons to do an electrophysiology study could include palpitations or an awareness of a heart rhythm disturbance. And patients with those symptoms would usually have some form of cardiac monitoring, where a ECG or a longer ECG recording with a Holter monitor will be performed. If a diagnosis is not found with that type of testing, then an electrophysiology study can be considered. For further discussion about this procedure, it would be worth looking at the heart itself and then the heart's electrical system. So I'll draw your attention to this model. This shows the different parts of the heart. There are the two top chambers, which are the atrium, left and right. The ventricles are here, which are the bottom chambers, left and right. The ventricles are the pumps that squeeze blood out to the rest of the body. And all of the heart, all four chambers, are controlled by an electrical system. So I'll draw a very rough diagram here of the heart and the heart's four chambers. We divide the heart up into four chambers. And if we look here of the heart being controlled by an electrical system, there's the sinus node, which we can think of like the spark plug in your car. There's the AV node, which we can think of as the fuse box, and there's two wires that feed the bottom of the heart. An electrophysiology study aims to investigate all the parts of the heart's electrical system. A series of wires would be introduced through the vein at the top of the leg and taken up to the heart to measure all the different parts of the electrical system. The spark plug area, the sinus node, the fuse box area in the middle of the heart, the wiring at the bottom of the heart. In some cases, a fourth wire may be introduced that allows the top and the bottom of the heart to be measured at the same time. Once those wires are in place, we would look to measure the different parts of the electrical system, measure the ability for the messages to travel from the top down to the bottom of the heart. And if we look at the normal arrangement of the heart's electrical system, we would have the top of the heart beating, then the bottom, top, then the bottom. And this is called normal sinus rhythm. So we can see the messages would usually start here at the top, then through these two wires at the bottom. Top, bottom, top, bottom, top, bottom, top, bottom. This is what we see on a cardiograph externally. We would aim with the procedure to make sure the messages travel from the top down to the bottom. We would also measure the ability for this part of the heart to function. And sometimes people develop lightheadedness or dizziness because the spark plug area, the sinus node, is not functioning correctly. And the procedure can allow us to test the function of this area. In some cases, we will also do testing on the heart by giving medications or using the wires themselves to try and trigger or cause a heart racing condition or sometimes a short circuit problem in the heart if a patient's symptoms suggest that being the cause of their problem. After the procedure, all of the wires are taken out of the heart. The procedure itself would usually take between 20 to 30 minutes. for a diagnostic test. That involves a study where we are just investigating the electrical system. For patients who are candidates for ablation, that's where we cauterize problems inside the heart. That is a longer procedure and is discussed separately in this webpage. After the procedure, most patients would be able to be discharged on the same day if it was a diagnostic or a testing type study. For patients requiring ablation, most patients are kept for 24 hours and discharged the following day. There are risks with a diagnostic or testing study. That involves bleeding, infection, blood clots and damaging the surrounding blood vessels and nerves from where the wires are put in at the top of the leg. We can damage the veins on the way up to the heart or the heart itself and cause bleeding around the heart. There's also the small chance of a heart attack or stroke. Overall, a diagnostic or testing EP study would be associated with a very low chance of complications, overall less than 1%. But even in experienced hands, complications can occur, and this procedure is best discussed with a heart rhythm specialist in terms of discussing the benefits and risks of the procedure. I'm happy to discuss this procedure again, should you wish, in a formal consultation. Thank you.